But I'm going to start with Dr. Gooden. I certainly enjoyed our visit yesterday, and I know I threw a lot of stuff at you, and I think we had a thorough discussion. But one of the things, as we spoke of yesterday, that I'm concerned about is health care. And throughout Mississippi, particular our Delta, the epicenter of our agriculture industry, we're currently facing some very severe potential hospital closures. And working on a farm is dangerous. We're livestock producers ourselves, and whether it's equipment accidents or handling livestock, it is critical that we have access to rural health care. I've had to leave the Senate floor to fly home when my husband encountered a bull. And, many family members, we've literally had to airlift because that's what we do for a living. But I'm just worried about how producers and farm workers in Mississippi are going to get that urgent medical care if the rural areas in which they work don't have a hospital. And the rural Americans face very unique health disparities and challenges compared to those in urban areas. But we grow the food in rural areas. It's hard to grow food in a subdivision. So I've worked to establish the CDC Office of Rural Health, support rural developments, Delta Healthcare Services grant programs, and provided resources for telecommunications programs to help rural Mississippi hospitals administer that. But when you have a patient, you have to get to somewhere. But this committee has spent a lot of time this year talking about using the Farm Bill to strengthen rural America by supporting farmers and ranchers. But I want to make sure that we look at the health care situation because of the obvious reasons that I've already stated. But if confirmed, what will you do to ensure that rural development's programs to support health care in hospitals are strong and effective? And how can Congress help the agency on those endeavors?
Thank you, Senator. And I certainly share your concern about health care in rural America. As a farmer myself, certainly understand the dangers of working on the farm. And actually, a longtime worker on our farm actually had a stroke, not on our farm, but he had a stroke. He worked for us for about 30 years. And actually, it took more than 4 hours for him to get to a medical facility because of the remoteness of the area, but also because of weather. And really think that his condition would have turned out different if he had easier access to health care. So certainly that's near and dear to me. That's something that we understand. I am excited to say that through our community facilities program, most of that program actually is, the portfolio is dedicated to rural health care, funding rural clinics in the areas. And personally, again, when I was the state director in Virginia, worked with a rural hospital in Appalachia, Virginia, out in Lee County, Virginia, to try to help find ways to make sure that that hospital stayed open as well. So very familiar with the significant issue rural hospitals and healthcare is across the country. And certainly I will commit to ensuring that we utilize our programs through rural development and community facilities programs and other resources, working with partners to address healthcare issues in rural America.
Thank you very much for that. And now I want to talk about some rural water systems. That's also very important to me, very important to my constituents, and I've worked to support Rural Development's Circuit Rider program, and that provides essential services to train small communities on how to best operate and maintain their water systems. Safe water, as we well know, is so critical. But I've also worked with Senator Cortez Masto to introduce the Rural Water System Disaster Preparedness Assistance Act to make sure rural water systems can resume operations as soon as possible after a natural disaster. And we have a lot of those in Mississippi because we have a lot of hurricanes in Mississippi. But these rural water programs administered by your agency are very important and helpful. But the application process also involves a lot of paperwork and a lot of red tape. As we talked about yesterday, the folks who are in the business of assistants and advisors to do this, that business is growing, the consultants, because it's so difficult. And I want us to be able to provide that as U.S. federal government, that when you come in and apply for these programs, we're the ones trained that can help you do that. So what opportunities do you foresee to strengthen and improve access to rural water programs, particularly through the administrative burdens?
Thank you, Senator. Very proud of our rural water program, our WEP program, and the people that run that program. We certainly look for opportunities to, again, collaborate and partner with folks on the ground. Certainly, we work with municipalities to deploy these programs, understanding that clean, safe water is essential to not only the health, but also business creation and job creation as well. So certainly we're committed there. Certainly things that we can do is actually work with our partners on the ground, but also make sure that Congress understands and make sure that we hear any concerns that your office have related to any of our programs at rural development and certainly around clean water. But we're here, again, I think we certainly have the knowledge and the expertise. We may need to augment the staffing in some of our field-based operations, the boots on the ground, and I think that's where we can focus a lot of our energy to get this job done related to rural water.
Thank you. And your both are so impressive. And I have more questions, but I'm out of time, so I'll submit those to the record. Thank you.
Thank you.